Dr. Walker. I hope you're feeling better. I really, really enjoyed the lecture this week. It was so interesting to hear from Dr. Duncan. So I think the main idea that I got out of this week is that healthcare is just kind of a balancing act. There's really no perfect way to have people covered or give people access. And I'm going to go over some of the concepts that I learned that I didn't know about before and try to explain them. So the first one that I thought was really interesting was the iron triangle. So I feel like the iron triangle really encompasses everything we talk about in this class, and it's talking about the three big goals of healthcare. The first one is cost, because we want healthcare to be affordable. The second is quality, because we want good healthcare that actually helps people and makes them feel better. And the third is access. We want healthcare to be accessible and available to as many people as possible. And the problem is that it's just impossible to have all three at the same time or improve all three at the same time. So like if you increase access, it raises costs, or it might decrease the quality of the care. And then if you cut costs, you're definitely going to reduce quality. And finally, if you improve quality, then you're definitely going to raise your costs, or you might just not be able to have access for lower income people. And it's just really confusing to decide what you're gonna trade off in this situation. What we've seen, we have seen the iron triangle work in the Affordable Care Act because it improved access by expanding insurance coverage, but it also raised costs for the government and other consumers. And the focus on quality from the Affordable Care Act created regulations that just made healthcare a little bit more complicated. So another thing that we talked about this week that I'd never heard of before was a waiver mechanism. So the government has rules about how Medicaid can work and how it can be given to lower income people. And sometimes the states want to try different things, so they use waivers, and waivers are a way for the government to let the state use that experiment to run new ways of Medicaid. So this we saw in the Oregon experiment. I'd never heard of this before, and Oregon just had a problem where they didn't have enough money to expand Medicaid to everyone that needed it. So instead of choosing who got coverage, they just did a Medicaid lottery, which was an interesting idea. Thousands of uninsured, low-income adults signed up, and only some were chosen to get Medicaid coverage. And researchers compared who got Medicaid compared to those who didn't. And that just gave us a chance to see the actual effects of getting health insurance. We already know that those who are insured will usually be better and have better health outcomes, but this gave us the data to see that. And what they saw is that financial protection improved, and that people with Medicaid had fewer medical bills that they couldn't pay and were less likely to go into debt. Their mental health improved because they saw that they had lower rates of depression. There was more preventative care. They were more likely to visit the doctor, get cancer screenings, and just take care of themselves and not have issues start and prevent them. At least they didn't see that there was huge differences in health outcomes like diabetes, blood pressure, and cholesterol, which was really, really interesting, but you could see all of those other benefits. And then finally, the Oregon experiment showed that having insurance does help people financially and mentally, but it didn't automatically lead to better physical health. And this showed us that health isn't just about having insurance. It's also about having access to specialists, long-term care, and taking care of those social aspects that it's not necessarily just healthcare, it's poverty and stress. And this study is used in Medicaid expansion debates all the time because they argue that Medicaid didn't necessarily improve their physical health, so it's not worth expanding. Another expansion that we talked about in this week's lecture was CHIP and S-CHIP. So S-CHIP or CHIP is a program that's just for children's health insurance. It stands for Children's Health Insurance Program, and it's for families that make too much money to qualify for Medicaid but can't afford private insurance so that their children can still be covered. It used to be called S-CHIP for State Children's Health Insurance Program, and it covers doctor's visits, hospital care, and other essential health services for children. So this was really interesting to me just because this is something that, kind of just seems like a no-brainer. Of course, people should be covered, but it's something where those children never decided to be low income. Those children never decided to, not have the means to not have healthcare. So it's the debate that we were talking about before with if children should get free school lunch or all children should get free school lunch. So the idea that we have CHIP is obviously great, but one thing that really stood out to me from the lecture this week is that CHIP enrollees are always at risk. So unlike Medicaid, CHIP isn't permanently funded, and Congress has to renew its funding every few years. So every few years, there's a debate over if children should have health insurance or if the government should be footing that bill. So if Congress doesn't approve new funding, then families could just suddenly be left without coverage for their children's medical needs. And again, this debate seems like a no-brainer, just like the school lunch thing. But it's really interesting to see that CHIP just doesn't have permanent funding and that they're always at risk, which is something that Dr. Duncan pointed out and I never knew. But overall, like I said, healthcare is a balancing act, and we can see that through all of these concepts. The Iron Triangle shows us that fixing one part of the system usually affects another, and that we can try to see who really needs Medicaid through using waivers and things like the Oregon experiment, and it shows us how beneficial health insurance can be. But overall, we can't really decide, or we can't really know who exactly needs it or how we can really take care of everyone. But we can really only fund people that the government knows needs that help through things like Medicaid and CHIP.